starting ophthalmology, it was a little bit rough because it's a whole new language, and you read, but you don't internalize stuff until you start seeing it. And you have all these like ideas floating around in your head that you can't really connect them all together until you start seeing patients. And once you start seeing patients, then stuff starts sort of clicking or at least that's what happened to me. It starts sort of clicking in your brain. And then I would read the cornea book, and then I had this idea of what the cornea was. And I would read the retina book, but then none of it was connected. And then all of a sudden, like I think 6 weeks or 8 weeks in, stuff started to making a lot of sense. And like why one patient who had multiple eye conditions was presenting with a complaint that was attributable to a certain thing, one of the diseases as opposed to all of them or whatever. It just helped you to sort of figure things out. But it takes a little bit for things to start clicking. And every time one of the incoming residents asks me like, oh, what's your recommendation? I always say, just read vigorously. I promise you things will start clicking. But if you don't read, it's just very hard. And for whatever reason, in ophthalmology, I've noticed that it's very easy for people to just sort of lay back and take the easy road in terms of just cruising through a residency. And I'm not saying that the residency is easy in any way. We work super hard, but it's just because no one else knows about ophthalmology, you can sort of learn bare minimum and not necessarily, give your best. If that makes any sense. So when my cousin started, I was like, the only thing I want from you is just that you read as much as you can, and you sort of become like responsible for your own education, even though you're going to get great education at our program. But, you need to put in the hard work.
That's an interesting take. And I think I agree with that 100%, at least in terms of what I've seen so far on my ophthalmic journey. I've often wondered how much of that, going back to intern year, is people who just have like a brutal intern year in terms of just the amount of work, the hours they're putting in. And it's like by the time they finally get to that stage of training that they were always hoping would finally come, they're starting, they're exhausted, they're sleep deprived. And like you said, the learning curve is so steep.
Super steep.
I was talking with Dr. Augsburg about this. It's a foreign language. You don't know anything about it in advance. You don't know how to use the instruments, the tools. Right. We're really not taught any of this in medical school, apart from, using the direct ophthalmoscope. And let's be real, how many of us like faked? Yeah, I can see the nerve or the retina.
Right.
So it takes a lot of self-motivation, desire to become better at something, to put in the work. And then while you're having that experience where you're essentially, to me, it felt like PGY2 felt like starting med school all over again.
100%.
And I did reading. I tried to read as much as possible intern year. I did 4 months of ophthalmology during intern year. I mean, I tried to really take intern year seriously in terms of getting to a comfortable state of knowing ophthalmology. But it felt like totally starting from scratch. I'm trying to learn the technical aspect of things. And then on top of that, you're taking primary call.
Right.
And if you're at a place like we are here, call can be pretty heavy sometimes.
It's busy.
And so, we don't necessarily get the post-call day off. You have to be in clinic the next day. And now you're going to pepper on didactics on top of that, or journal clubs or conferences. So much of your week is taken up already. And I can empathize with, people maybe who just want to take a step back and chill a little bit. It's understandable. But I think you're right. I think there is a danger of, I was talking to someone who's out in practice for cornea, and because I'm going to be applying to, anterior segment cornea refractive fellowships. And I was trying to just pick his brain on some topics. And he said, the definition of complex in terms of managing a complex cataract or a complex corneal issue or something, he said, is pretty much what someone didn't experience in their training, whether that was in residency or fellowship. And so to them, that's complex. But to someone who's had that training, or they've seen that before, or they've taken the extra effort to read about it, to do research or talk to people in the field about it, they're much more comfortable with that. And it doesn't seem as complex to them. And I thought that was kind of an interesting take that just sort of reiterates that you have to kind of be in the driver's seat. You have to take ownership of your education. I feel that way about surgery as well.
Yeah.
You have to take ownership of your own, advancing your own surgical training. I'll tell you what, I'm mortified. I'm very, very scared now that I'm about to start my last year, because I feel like I've taken residency very seriously. I've tried to work as hard as I can, but now there's a light at the end of the tunnel. I got 1 year left, and I feel like I still have so many knowledge gaps or connections I'm trying to make. And then on top of that, this is the year where we really start to do a lot of surgery. I'm happy I'm going to be doing a fellowship, and I'll keep up with lifelong learning. But
Right.
to me, it's like now the countdown has started, and so I'm very much trying as much as I can to stay up with doing reading again. And I think a couple people have told me in your last year you're so focused on learning cataract surgery that a lot of your clinical skills sometimes can fall by the wayside.
Hmm.
So low key, I'm trying to like actually double down on retina. I'm trying to like learn as much about retina as I can, even though I'm going to be in the future
Right.
working on a separate part of the eye. So I don't really neglect that.